Hi, everybody. My name is Dr. Jason Gent. I am the training director at the Mailman Center for Child Development at the University of Miami Miller School of Medicine. Now, as you can see, I'm not hanging out at the Mailman Center right now. Um, I'm hanging out in a coffee shop. I'm a weird guy that is recording himself in a coffee shop where mysteriously there's no sound around me. There's no other customers. But yeah, here I am doing that. I'm here just to give you a brief intro to what you can expect for this virtual coffee house overview. One is I'm going to take just a short amount of time to give you kind of a broad stroke overview of kind of what you can expect in terms of training here at the Mailman Center. And then you're going to get the chance to hear from people that are far more important for you to hear from in terms of your decision making process about whether Mailman's a good fit for you. So I'll have some coffee house chats with the various supervising faculty from the specialty tracks, as well as elective rotations that you may choose to do once you get here to the Mailman Center if you choose to become an intern here. So let's go ahead and get started of just kind of a broad stroke overview of the Mailman Center. We provide specialty training in the areas of pediatric psychology and clinical child psychology. And we have just a number of clinical rotations that allow for applicants to gain additional experience and competencies in these areas. We are APA accredited. We are accredited through 2028. And we also have a robust practicum program from local institutions that feed into our center. And we also have several postdoc positions, which I'll talk about those things more on the actual day of the open house. So our general goals as a part of our program is to help promote profession-wide competencies in the area of assessment and therapy, but also trying to help you with our PSYCH lens with consultation and an emphasis on prevention. We also want you to get some exposure to pediatric health rotations. The beauty of that is that each of the specialty tracks where you'll be spending at least half of your time on for the entire training year will get at some of those competencies. And on the day of the virtual house, I'll actually walk you through that process a little bit more. Because it's an interesting process in that every year, even if you're in the same track, while some people on a specialty track will at least maintain the things that they have to do over the course of the training year, is there's also some flexibility for them to build out elective rotations for the clinical training opportunities that they are most interested in getting additional experiences that will set them up for whatever the next best steps are for them. So that part is unique about us. The other part that's a little bit different about us in terms of the structure of our program is that while you will maintain your specialty track training for the entire calendar year, your elective rotations are set up in 6 month blocks. So I know other sites may have 3 month blocks or 4 month blocks. We do 6 month blocks, and then you have the opportunity to swap out. I would love to say that you can do everything while you are here. But if you do everything while you are here, you will work a zillion hours and you probably will not be happy. So we do work with you on building out kind of a personalized training schedule, especially during the first half of the year that's going to set you up for whatever your next best professional steps are. And then if there's some core competencies that you still need to meet, we'll make sure that you get those things in the second half of the year. Um, Other things is that sometimes your specialty tracks, not all of our specialty tracks or elective rotations exist Monday through Friday. Some of them are just available on particular days. So if your specialty track is something that happens on a Tuesday, right, all day, and you have to be there, there may be some other rotations that are only offered on a Tuesday, which that would preclude you from doing that. But you'll be able to see that when I go through an example on the actual day of your open house. So that's the structure. Again, you'll hear from lots of the rotation supervisors. I want to talk a little bit more about the training elements. So our program really does strive to provide developmentally appropriate supervision. We have a broad range of candidates, and given that our specialty tracks are quite diverse in nature, that many times people come in with experience on their specialty track, but perhaps, on our clinical child psychology track, they've never done pediatric psychology rotations. And the nice part is that we have a continuum of rotations on the clinical child side as well as the ped psych side that allows you to kind of like put your toe in the water and kind of test it out and see if it's something that you might actually like. We understand that some of you come from institutions where there just was not opportunities based on what was available for the faculty that were there at your institution or the practicums that were available to you. In terms of other aspects of training, we do have a weekly pediatric psychology seminar series. And feel free to ask us more specific questions about that during the open house. But it is a blend of talks. I will say that upfront. Miami is a racially and culturally diverse community. It is a very large immigrant population, and there's also a lot of rich history here that can help you have better context of kind of where people are coming from that live within various neighborhoods throughout Miami-Dade County. So we spent a lot of time actually at the beginning of the training year of giving you didactics that are really set up to help you better understand the community and the population that you're going to be serving here. Some of that is more didactic based, some of it is more of a history lesson, some of it is a bit more experiential. There are DEI components. There's also anti-racism components that are built into that training. And sometimes just kind of walking through scenarios of how would we handle that? How does this fall in line with APA ethical codes? But we also want to make sure that you have practical tools to do the things that you want to do. So we build into orientation week for those that have never done consultational liaison services, just an overview. What is that actually? Or you're like me and you don't speak a language other than English, and that there may be times here or other places where you'd be using interpreter services. And we'll set you up so that you understand how to utilize interpreter services here effectively while you're at the U. So beyond that seminar series that goes in, again, it's a wide variety, and we ask you kind of the things that you want to learn about, and there will be things that are related to the core rotations as we progress. We'll also ask for trainees to give continuing ed presentations that are part of your own professional development that happens towards the end of the training year. We also will have a separate meeting for y'all that is an ongoing training directors meeting that also incorporates aspects of professional development. So this kind of serves as like a professional homeroom, a check-in, a chance for you to get to see your colleagues, talk about things that are going well, things that are not going so well, providing me feedback so that I can make sure that we're working on problem solving things as things arise versus waiting for like formative evaluation periods. I always like to find out what's going on sooner so we can deal with it then versus finding out about it 6 months later, where there could have been something that would have made a trainee's life much better 4 months ago. So that is one aspect that we have that is a part of our program. The other part that is part of that is the professional development, right? So it's things like prepping your CV or cover letters for whatever that next professional step is for you. It's salary negotiation. It's also just bringing in things of like different career paths, right? So not all of us are doing the things that we thought we would be doing in the world of psychology, and there's just a broad field. And sometimes it's good to see that other kinds of jobs or areas of specialty exist in the field that can expand our horizons beyond just academia, right? So bringing in people that have started a private practice and they talk to you about that, or people that have gone into more policy jobs and talking to you about that. And each year, this is just really dependent upon what the trainees are interested in. So our professional development talks really change from year to year on that front. The other thing that we have as a part of our program is mentorship, right? So we want to make sure that you have a go-to person that You can just check in, meet with at least once a month. That's someone that can provide you guidance, or it could be another person where you feel like you might have psychological safety or trust to be able to speak about things that are going on. That person can help guide you towards next career steps, or family planning steps, or whatever that means to you. It's giving you that space to guide you along in that process to make sure that your job well-being is great, your personal well-being is great, and we're just making sure that those things are maintained. Is the other things that we have as a part of our training program is the LEN program. So this is something that we have all trainees engage in. LEN stands for Leadership in Education and Neurodevelopmental Disabilities. So this is something where we give you additional training in the areas of advocacy and policy and understanding um, how to engage in family center planning as it relates to services, and making sure that we're helping to promote your ability to engage in interprofessional communication and services, because a lot of our programs, as you'll hear in the coffee house chats, are interdisciplinary or interprofessional in nature, and figuring out how to navigate that. So that is something where we have trainees go through that. It's within a 1 month time span over the course of the year. We allow trainees to kind of pick like the month that works best for all the other things that they have going on in their life to make sure that that works. And you meet with a number of different fields, right? So we have medical residents that will be a part of that, medical students, speech and language pathology students, audiology students, physical therapy students, social work students. There's a broader range of trainees which allow for that experience to be interdisciplinary in nature. All right, so I've talked enough, and I want this to be something that is useful for your time. The beauty of this being on YouTube is a couple different things, right? So one, if I'm talking too slow for you, you have that ability to control it up, right? Control the speed, speed me up, slow me down, whatever you want to do that makes this work for you and your schedule. The other thing is that things are time stamped, right? So you may not be interested in everything that we're doing here. And there's particular areas of focus that you want to know more about. That's okay. We're going to timestamp, what rotations are talked about between what, minute and second and what minute and second, so that you can determine how to best utilize that. Also, once you find out who you're interviewing with, it may give you some sense of like, oh, well, I might want to actually review more, about this rotation since I'm going to be chatting with this person. So I hope that you enjoy this coffee house overview. I hope that you get yourself a hot beverage, a coffee, or whatever beverage you prefer while you take this all in. And we're very excited to hang out with you when you actually come here on your open house and interview day.
In this chat, you will learn about our funded pediatric psychology specialty track. You will also learn about our hematology-oncology rotation.
Well, we are here just really excited to talk to everyone about our pediatric psychology track, talking about the main positions and rotations we have available through that track, as well as some of the elective pediatric psychology rotation experiences that you can have. So here we have the chief of the division, Alan Delamater, Louisa Malley, Jennifer Cotto, and our newest faculty, Juliana Acosta. And before we get started, I always want to start with the hard-hitting questions, the most difficult questions that our candidates really want to know is, what is your favorite hot beverage or coffee or tea that you prefer to rock each and every day? We'll go with you, Alan, first. What's your go-to?
Well, I'd have to say it's a cappuccino. And I do want to add that one of the most important skills I learned during internship many years ago was how to make a proper cappuccino. I actually got a job as a barista in a real coffee shop as an intern because they didn't pay enough money. I needed to make a little extra money. When the manager, I saw a sign that said help wanted over the espresso bar. And I found the manager and she said, well, what are your qualifications for this? I said, I'm a psychology intern. I got hired on the spot. So there you go, cappuccino.
Go. And in terms of how much we pay residents, some things never change. All right, what about for you, Louisa?
My preferred beverage has a very long name. It's tall, skinny, decaf vanilla latte from Starbucks.
Okay, so you're the person that like people have to look up your previous order to remember how to actually order it.
Correct, correct.
Okay, very nice. And what about for you, Jen?
So I'll say a latte in the morning from Starbucks, and then in the afternoon, a little Cuban cafecito.
Cafecito, very
Yeah,
good. And Juliana?
cafecito for sure.
I'm just gonna be the cliche iced latte with oat milk. That's my go-to. I'm also a coffee snob. I'm a Colombian, so my coffee has to be of very good quality, freshly ground. How do you say it? Grind
Ground.
coffee beans, grounded
Yeah.
coffee bean.
Right. So always judging. And we
Oh,
do
we're judging.
and we do have a coffee bar actually available for the residents that we keep stocked, and our program coordinator does bring around cafecito, usually late morning or early afternoon, or sometimes both, which is really exciting. Um, so we're going to be talking about the pediatric psychology tracks. Just really, we want candidates to get a good understanding of what they can expect to get out of this experience. And this experience is really well-rounded with a blend of outpatient experiences, interdisciplinary clinics, and some inpatient opportunities as well. We're going to talk about the core positions that make up the track first. We'll start out with our pediatric psychology clinic with a child health emphasis, and we'll go to Alan first. Let's just give us a little glimpse of kind of what can residents expect to get out of that rotation.
Yeah, well, you will get lots of experience with very interesting and usually complex cases. So the patients we see in this outpatient clinic are kids with various health conditions. Their conditions could include toileting difficulties. We actually have quite a few kids right now we're seeing for enuresis and encopresis. Pain could be migraine, tension headaches, chronic health conditions like diabetes, obesity, functional GI disorders is a common type of case, and we see others such as kids with spina bifida, or kids with pill swallowing difficulties. So really, it's all about psychological factors that affect various physical conditions. So that's adjustment to these issues and regimen adherence issues as well. Our patient roster is varied in terms of their cultural backgrounds and socioeconomic status, although all the kids in this clinic are, by virtue of our requirements, kids whose families have a commercial insurance, but we do see a pretty wide range. So I think that, the objectives really for the residents are going to be to really learn how psychological and behavioral factors affect the management of these conditions in both smaller children as well as adolescents, to learn how to manage these conditions using evidence-based behavioral psychological assessment and interventions in the context of developmental and family functioning.
Yeah, and what I love about this rotation is I find that, and you don't see lots of many like outpatient therapy clinics that are specifically focused on this. And when I think about like community providers, there are not a lot of community providers that have this special skill set. So I think there's a unique opportunity for pediatric psychology residents to gain competencies that maybe they wouldn't be able to find at other pediatric programs that are more focused just purely on CNL kinds of skills.
Right. And this is, of course, a psychology outpatient clinic, but we interact with referring physicians. So we get a lot of referrals from pediatricians and specialists. And of course, we want to communicate back with them about how things are going with their patients.
Great. Thank you for sharing about that, Alan. Next, I'm going to go to Louisa. So we are going to shift to more of CNL. Louisa is the supervisor for a couple of our track-specific ones. We'll have her talk initially about her diabetes clinic and her cystic fibrosis clinic that she supervises, and what psychology residents could expect to get out of these rotations.
Thank you, Jason. So as you mentioned, both rotations are consultation liaison rotations. And they have some similarities across rotations. So both in diabetes and CF, we have a psychosocial screening program. In diabetes, we have a much more comprehensive psychosocial screening program. The intern takes a lead role in really working with that program and learns how to interpret, communicate results to the endocrinologist or a pulmonologist in the team, and really learning how to identify and work with patients with a variety of difficulties. I will say that one of the primary differences across clinics is that in diabetes, we don't see every patient who comes through. The referrals, therefore, tend to be a lot more acute. So in that clinic, we end up seeing a lot of patients with significant adherence issues, a lot of patients with significant psychological issues. So in that clinic, we routinely do risk assessments, especially because that's one of the areas in which our screening program does a really good job of capturing their functioning. And that's not necessarily the case in cystic fibrosis. In cystic fibrosis, we see every patient who comes in, and we have a pretty packed schedule each clinic day. In CF, we work with a lot more feeding issues, a lot more developmental concerns, a lot more adjustment to diagnosis and kind of supporting parents and building self-efficacy and, fostering independence. But it tends to be a less acute population. Across both teams, there is a significant opportunity to contribute to, with interdisciplinary team work. In diabetes, we work with 4 endocrinologists, pediatric endocrinologists, 2 certified diabetes educators, and nurses. And then we refer to a dietitian when needed. In cystic fibrosis, we work with now 3 pulmonologists, a social worker, a dietitian, a respiratory therapist, and then we have an RN, other nurses, and then we have occasionally students and residents kind of rotating through. The teams have varying level of integration. CF, although we're integrated, and because the patient population is much larger, we don't have intense collaborations about each patient. In CF, we have pre-visit meetings, post-visit meetings, and we're very much a very cohesive and integrated team. Diabetes can be a full-day rotation or a half-day rotation. CF is primarily a half-day rotation. And right now it occurs biweekly. So it works a little bit different that in the off weeks, we can sort of arrange for other activities so that the trainees continue to gain experience.
Yeah, it sounds like some really amazing interdisciplinary clinics, interprofessional teaming experiences that are available in those rotations. One thing I wanted to note is, as I mentioned kind of in the introductory videos, that all of these rotations we have are available as elective rotations. So even if you're not the pediatric psychology resident, if you're one of our other residents, you have the opportunity to engage. As actually part of our core competencies is having a pediatric psychology competency. And we find that a lot of our trainees who have perhaps not had the opportunity to engage in pediatric psychology clinical experiences, that diabetes is really like oftentimes a very good starter rotation for that as well. So thank you for sharing about that, Louisa. Now we're going to talk about another core part of our pediatric psychology track, which is our hematology oncology rotation. If you'd like to talk about that, Jen.
Sounds good. So my patient population consists of patients that are 0 to 21. So that includes their, parents or any siblings. And these kids have either blood disorders, some type of cancer. They may be undergoing a bone marrow transplant or gene therapy, which we're doing now, which is really cool at the hospital. Here we see patients inpatient at the Children's Hospital. So this is an inpatient rotation where we see patients at Holtz Children's Hospital on either the regular floor or on the transplant floors. And then sometimes in the intensive care unit, if some of our patients have moved there. We also see patients in our outpatient clinic, which is called Alex's Place, which is at the Sylvester Comprehensive Cancer Center here on campus. And then we'll also see patients, just your typical outpatient, through telehealth or in person at the Mailman Center. So some of our presenting problems, they really range from treatment adherence, adjustment to diagnosis, pain management, end of life, depression and anxiety. So pretty much all the things. You'll learn how to do inpatient consults on this rotation, which is very different than your typical outpatient therapy sessions. You'll also learn how to do pre-transplant evaluations before kids get their bone marrow transplants. You'll do your typical outpatient therapy, but just with kids who have a certain medical diagnosis. We also work very closely with the medical team. We're very integrated. We also work with residents and fellows who all have to rotate through HEMONC as part of their training. We work with child life, music therapists, speech therapists, social work, pretty much all of the things. We also assist in training the medical residents. So we do a really cool simulation called Breaking Bad News, which our trainees can help with. And then one of my favorite things is that we get to participate in a lot of really fun activities at the hospital. So we recently had like a In My Holtz Eras tour, so our own Taylor Swift concert, and then all the typical Santa stuff and Feel Good Friday. So there's a lot of fun events to do in the HEMONC rotation also.
But Taylor Swift didn't actually show up to the hospital.
She did not. We tried really, really hard. Big social media push, but she's busy.
See. So as you can see across these kind of core tracks as rotations we have, is you're going to get a lot of excellent breadth and depth of experience across a wide range of pediatric psychology competencies that really could prepare you for a broad range of postdoctoral or academic medicine careers in pediatric psychology. We're going to shift and we're going to talk a little bit about some of our elective pediatric psychology rotations as well. So we'll switch to Juliana, that's going to talk about our pediatric sleep clinic.
Sure. So this is a new clinic for the residency program. And this is an elective half-day clinic, a consultation liaison rotation in which we're gonna collaborate with an interdisciplinary team you are gonna be the behavioral health specialist within an interdisciplinary team for pediatric sleep problems, which can typically include obstructive sleep apnea, insomnia, circadian rhythm disorders. And you'll be able to collaborate with the team to develop behavioral plans, treatment plans. They do in the clinic conduct some psychological assessment brief, which can help inform treatment plans. And then, of course, we will provide referrals as needed, and we'll follow up with them. But this is not an outpatient therapy clinic. It's consultation liaison with the goal of also following up with the patients that we see to see how they're adhering to their recommendations, so how we can problem solve around that. Yeah, that is all I have to offer.
That's great. And I know we hear about all kinds of child sleep problems in a number of our other clinical rotations. So to have a place for them to go is really amazing. We're going to talk a little bit about some of our other elective ped psych rotations. I'm going to go back to Alan, who supervises our GI clinic, if you want to talk a little bit about that.
Sure. Just wanted to add that we're really excited that Juliana is developing and offering now a pediatric sleep rotation. Because actually, as Jason mentioned, we see lots of kids in our ped psych clinic who have sleep problems. So we end up doing interventions for sleep. A lot of times it's sleep onset insomnia that a lot of these teenagers have who are really anxious and stressed out. But speaking of anxious and stressed out, that characterizes a lot of the patients that are seen in the GI clinic. So this is a rotation. It's offered on Wednesday afternoons currently. It has been typically on Wednesday afternoons. And it is an outpatient clinic for one GI specialist in particular, Dr. Miguel Saps, who's the director of pediatric GI. We like working with him in particular because he's so appreciated. Actually, all the faculty do in GI. They really appreciate the role of psychological factors in affecting the GI problems. In fact, these are disorders of the gut-brain axis, in fact. So a large part of the treatment of these kids involves psychologists or should involve psychologists for that matter. And Dr. Saps, because he is so aware of these issues, he integrates the psychology resident in every case, pretty much every case that he'll see in an afternoon. So the resident will have the opportunity to interview patients, watch how he interviews patients around their problems. And most of these are functional GI problems. So kids with chronic abdominal pain, kids with constipation, that's very typical in this population. But there may be a full range of other interesting problems. This would include Crohn's disease and ulcerative colitis and other abdominal migraines and so on. But besides interviewing the patient, the team then discusses each of these cases in the conference room. A plan is kind of arrived at. And so the psychology resident also has an opportunity to conduct brief interventions. We often take some of these cases for follow-up in the GI clinic, so they could be offered short-term behavioral therapies to address their issues, or they may be referred out. And one of the places they get referred to, you guessed it, the pediatric psychology clinic.
Excellent. Thanks for sharing about that, Alan. And then last but definitely not least, we have Louisa to talk about our primary care practices, especially with the idea that so many of the behavioral health issues, the primary care or the pediatricians are really the gatekeeper for identifying those issues.
Absolutely. So this is a half-day rotation. We receive referrals from a number of our pediatric practices, and we have a partnership. We have actually a contract with the Florida Department of Health and a grant that allows us to train pediatricians to increase access to pediatric mental health services by building their capacity in identifying mental health concerns, treating and referring children who are experiencing mental or behavioral health conditions. And we do this through a mix of working with those patients, triaging, doing consultations, and limited follow-up. So this is both a rotation in which you will be doing consultation as well as short-term treatment up to 6 weeks. And you also have the opportunity to work with the Behavioral Health Hub in the triage of these cases to learn about disposition and learn about how to think through those cases and training the pediatricians. So we also do quarterly trainings. And so we'll have the opportunity to contribute to those trainings, again, to help kind of transform the pediatrician's practice and build their capacity.
Excellent. So you can see we have lots of different pediatric psychology training opportunities here at the Mailman Center for Child Development. I want to thank each of you for sharing your expertise, and I know that you'll have far more fruitful conversations with the candidates on the day of our virtual open houses. So thank you all, and we'll talk to you soon. So normally we'd be hanging out in coffee houses with groups of people. But silly me, I forgot to include NIE and the Pediatric Mobile Clinic and more of our PEDS rotation. So I'm so excited that she was willing to hang out with me for a few minutes to talk about this other really cool primary care option that we have here at the Mailman Center. Though the clinic resides at the Mailman Center, but it doesn't really provide services. It's really out in the community. But NIE will tell you about that in a few minutes. So NIE, first question, most important question always, what's your favorite hot beverage or hot coffee?
Favorite hot beverage, yes. I don't like cold beverages that much. Is a
Drink like
cappuccino.
hot water by itself? Is that a thing that you'll do?
No. But tea and then coffee with like cappuccino.
Okay.
With cinnamon.
Are you more team tea or more team coffee?
Team coffee.
Okay.
I'm drinking coffee right now. Team coffee.
Team coffee. Okay. So yeah, tell us a little bit about what trainees might be able to get out of an experienced pediatric mobile clinic. I know it's a very unique experience that really allows us to reach a number of underserved communities. So whenever you're ready, go for it.
Yes. So the Pediatric Mobile Clinic is a primary care rotation that takes place in the community, and we serve children and youth that are uninsured. So usually it's underserved, a lot of new immigrants, people that have lost their insurance for whatever reason and they're in transition. So, and we go to community sites in this blue bus. And people think that I ride the bus, but I never get to ride the bus. We drive to the sites and then the bus meets us there. So we provide everything that a pediatrician would provide for these kids, also like a medical home. But definitely we provide them with like follow-ups, with physicals, labs, shots, vaccines. I mean, everything that a primary care pediatrician would do. But plus we have social work and mental health support there.
Very cool. Now, so one of the things that she mentioned, I think is important for trainees to know is that it's one of those rotations where you have to use your own transportation to get to that site. The calendar is usually like published a month or two in advance, so you know kind of what sites you're going to be at. Typically, I think they tend to be in the same communities on the same days, but Anna, maybe you can clarify that.
Yes. So transportation is needed because we travel to the community sites, and usually the sites they're published. The sites usually are the same, and so we usually go like on a Tuesdays to the same site or Thursdays, and we go out Monday, Tuesday, Thursdays, and Fridays. Wednesday is an office day, and then sometimes there's small changes. So every month they'll send us like a new calendar. With like small changes that have taken place because the site has canceled or we have to add a new site. But usually the site, so also the population knows where we're going to be. But they make appointments. It's by appointment. It's not just like we take some walk-ins, but usually is by appointment.
Okay. And then this is something that I know that's been asked over the years related to this rotation. When individuals hear new immigrants, they're like, well, I'm monolingual, I only speak English. And I imagine that a fair amount of the families that are or youth that are served may not be proficient in English, that they speak other languages. And so would that prevent them from doing the rotation? If not, what does that look like for them?
Yes. So yes, speaking Spanish or Creole, because we also go to Little Haiti twice a week, actually, is good, is a benefit. It doesn't mean that you don't speak those languages, you cannot do this. Actually, I have a current intern, a practicum student right now who doesn't speak Spanish or Creole, and she's doing wonderfully. It's just, we use interpreters. I can interpret, but also we can use an interpreter on the phone. So definitely there's not a requirement, but it just helps, to navigate, with the population, but all the staff is bilingual. And definitely there's a lot of people that speak English as well. And the kids, they may have been here for many years and they speak English.
Sure. And I think the diverse communities that we have all throughout Miami-Dade, you're going into some of these. I also imagine that there's also diversity in coffee choice. So in the various places that you go, is there something that stands out like, hey, I like to go and get this when I'm within this community because like this one shop, like it's really amazing, or anything like that?
Any Cuban I guess, little restaurant would have amazing coffee. Like, I'd rather go to that and get a little, espresso or colada, which is coffee with milk, right? Colada is only espresso, I'm sorry. And cortadito is coffee and milk. So you can get it for cheaper and it's better than any Starbucks. Sorry, Starbucks, but it's true. It's cheaper.
Starbucks is not sponsoring this virtual house. So if it shows
I love Starbucks.
If it happens to show up in like your YouTube feed while you're watching this as one of the advertisement, that's not on us. Okay. We had no part.
Yeah. No, but definitely any Cuban little place, they will have wonderful coffee and it's way cheaper and you can just grab and go. They have a little window where you just, pick it up and go. So
what do you see as like the most often like presenting concerns that you see kind of pop up in the clinic? That just, and then maybe
we have, actually, the things ADHD, kind of rule out behavioral, problems, developmental delays, depression, anxiety, PTSD, a lot of people with trauma. So I think those are the primary things. A lot of delays, actually, a lot of little ones. Lately, we've been receiving a lot of referrals for screenings. The clinic itself does screenings for developmental delays, 0 to 5, but we follow up by connecting the kids with agencies that can help them. So yeah, a lot of little ones. We didn't used to have that many little ones, but now we do have a lot of them.
Okay. Well,
so those are the primary concerns, pretty much. Yeah.
Well, thank you, NIE, for hanging out from your coffee house. And we appreciate your time. And I think it just helps applicants get just a better sense of kind of like one of these unique training opportunities that does not exist in a lot of places across the country. So thanks for sharing. And we'll see you all soon. All right. So I am here with Dr. Lizzie Pulgaron. She is the primary supervisor for our school-based integrated primary care rotation. And Lizzie, working at all the schools that she does, was kind enough to pop in from a coffee shop that clearly is near one of the schools that she works at. This is not within the schools. The schools are not that fancy, unfortunately. But she's first off, most important question I'm going to ask you, what is your favorite coffee drink?
Well, that's easy. Even my kids know my favorite coffee drink. Grande, hot, caramel macchiato with non-fat milk, just 1 pump of the vanilla, but the regular vanilla, not the sugar-free one, and extra foam, please.
All right. Oh, I like how you say the please at the end so that the barista does not hate you as much. So all right. So, I mean, there's a lot that goes on with your rotation, but I think it'd be helpful for applicants to have some sense of kind of what types of things or services they might expect on your rotation. I think sometimes when people hear school-based integrated primary care, they may think like more of a traditional school psychology lens in terms of thinking about it. And I think it's a little bit different. Or if you just want to talk about kind of the population that they would likely be encountering while working with you.
Sure. So I'll give a little bit of context. So the schools, first of all, we service 9 schools, mostly in North Miami. And in the schools, we have a breakdown of high school, middle school, elementary. Most of our direct services are in the high school clinics because we call them our full service clinics. So envision something similar to what you might get in another primary care rotation, right? So these kids are coming into the clinic for their wellness checks, sick visits, vaccines, anything that you would go see a primary care doctor for. We do refer to subspecialties on the main campus or satellite clinics for specific needs, but we have mental health services. So that might look like a consultation, individual therapy, group, pretty much what traditional primary care looks like, with the added benefit of being in the school setting. So one of the unique pieces about this rotation is that we really reduce barriers to care for the community. These schools are all Title I schools. They're in very high need, low resource areas. We deal mostly with immigrant populations. Not so much Spanish speaking like some of the other rotations, because in North Miami, we have more of an African-American and Haitian population, but we do occasionally have recent immigrants from South and Central America and different locations. So very similar, like I've mentioned, to primary care, a lot of consultation. We have an integrated team. We have physicians, nurses, social work. Depending on grants and different opportunities, sometimes we have subspecialties that are working with us. I would say the added pieces of this rotation are learning how to work in a community setting. So I think in primary care, you're going to get all the interdisciplinary relationships, right, with the physicians and different team members and all of that. I think you would get in other settings. At school health, you're going to get that plus being in the community. And when I say community, I mean the school district. We work a lot with the SHAC, which are School Health Advisory Committee. So we do some work outside of the schools per se. For those who are more interested in advocacy, there's opportunities. We do teacher trainings when that opportunity comes along. We do some consultations, not just with our physicians, but the assistant principal. Any emergency at the school, we're often called in. So if there's any type of crisis, if there's risk assessment, It's not our primary responsibility, but we're an asset. These are colleagues that we work with. So just as much as you would work with a physician, you're going to work with the assistant principal, with the teachers, with the security guards. It really is, it's a great experience as far as learning how to work with different disciplines, not just in the medical setting, but outside into the community. So I really appreciate that. And I think our students in the past have very much learned a lot about how to integrate into different settings, with the ultimate goal of providing the best care for our kids. At the end of the day, that's the number one goal for our program as a whole. And it's a really nice opportunity to be in this setting. I would say too, if I could add, we see a lot of diversity in our presenting problems. So some of the more pediatric CL rotations might be very disease specific or age specific. We see a little bit of everything. Everybody goes to school. Most people go to school in some way or the other. So we're not as circumscribed as other rotations. We see a lot of anxiety, depression, a lot of trauma, a lot of adjustments. As I mentioned, we have a high immigrant population. So there's a lot of different needs that these kids are coming in with. Plus getting to a new country, a new school, a new language, potentially a new family. So there's a lot of working pieces there. So I will say they are probably the most intense cases that I have seen in my career. At the same time, probably the most rewarding. So it's not easy. It's not for everybody.
Yeah, I think you spoke to just across for all applicants that I think just, you can have everyone's experience kind of coming into your rotation or any of our other rotations. Really, no two people are going to have the same, experience, because everyone's going to have slightly different goals, and they're going to bring in particular skills, or they're going to have a particular focus on what they want to further develop it. And I think your rotation is really set up nicely for people to have a wide variety of skills that they can further develop or enhance. Well, thank you so much for hanging out with us today, Lizzie. And, I'm very impressed that the person in the back of the coffee shop has been able to just sit so still that entire time. It's impressive. It's impressive. So thank you.
I told him to be on his best behavior.
That's right. So, I don't know what that equates to in terms of point systems or whatever for the school, but hook the dude up. So
In the next overview, you will learn about our funded autism spectrum disorder and neurodevelopmental disorders track.
All right, so we are here with our amazing assessment supervisors. We have Dr. Meg Harladay, and we also have Dr. Abby Peskin. And we're going to be chatting with them about some of our ASD ND specialty track of training that we have here. But we always like to start these asking the most important questions that the applicants care about the most. And so we're going to start right there with hard-hitting questions such as, what is your favorite coffee or hot and or warm beverage?
Want me to go first? Sure. There are so many to pick from. In Miami, we have many different options, and I like to try all of them, often on a daily basis. So I will start with my café con leche first thing in the morning, and I will usually swing by Starbucks on the way into work. In the afternoon, I'll probably switch to American coffee, or in my office, there is someone who makes Cuban coffee every afternoon and will come by with a little cafecito. That's always a treat. So I do all of it.
Plenty of coffee shops. So Meg works on the Gables campus, which is different from where the Mailman Center is. It's about a 20-25 minute train ride between stations. But really, like her, she has her nice mobile order set up right across from campus. I will also say, for those of you who do care, this is not an infomercial for Starbucks, but we also have a mobile order on the medical campus as well. So it's just a nice little 5 to 7 minute walk over there. Abby, how about you? Preferred hot beverage or coffee?
Café con leche is also my favorite. And I will say the medical campus, the hospital has the best café con leche I've ever found in Miami, anywhere. So you're lucky to be somewhere where the café con leche is the best. And it'll keep you awake for multiple days. So that's my go-to.
Because Abby just likes to be awake for multiple days, apparently. Getting things.
That's how she's so productive. Now we know your secret.
The café con leche, that's it.
Yeah. sleep. So both Abby and Meg are they're interesting supervisors in that they both were interns here at Mailman in this specific specialty track. So they must have liked it for some odd reason because they stuck around. Meg was actually the first ASD intern that we had. So she was kind of our guinea pig with respect to that. And apparently she must have done something right because it's still around. This will be, I think, actually like the 10th year of it that we're offering. So Meg went from intern to postdoc to faculty, and then Abby went from intern to postdoc to now she's a staff psychologist that we have on here as well. So they have a unique perspective because they have seen kind of both sides and both rotations that are tied to this track in a similar way. So excited for you to share your wisdom with applicants. We will start off with talking about IDES. And because it's psychology, we have IDES and we have ASAC. So we'll let you all explain like what did those letters actually even mean. And Abby, we'll have you start talking about IDES first and kind of like, what is it? What can interns expect to get out of that rotation? And at the end of the rotation, what might they walk away with?
Yeah, so IDES is our interdisciplinary assessment clinic at the Mailman Center. So what that means is that you're working with a multidisciplinary team. So you're doing the psychology assessments, but then there is also a developmental behavioral pediatrician who's working on that team, as well as a physical therapist, an occupational therapist, a speech language pathologist, an educational specialist, an audiologist. And so although it's psychology, you do your evaluations with your psychology team, then you come together as a whole group multidisciplinary team to discuss the case every week on a Wednesday. And then you really hear a lot from the other disciplines about how the different ways that the child's presented can contribute to what you saw with that child behaviorally, diagnostically, and you can really get a good picture of why you're seeing what you're seeing and from a whole child's perspective, what to diagnose. One of the things that's unique about the IDES clinic is, aside from the multidisciplinary perspective, is that kids really only get referred to IDES if they need a multidisciplinary assessment. So you're going to get some really unique cases that you might not see in other places, like children with specific genetic diagnoses, children who potentially couldn't obviously be diagnosed with ASD, but now they're 12 and they're presenting with symptoms and we need to figure out what's going on. So really, I feel like what you leave with is a really strong foundation of how to differentially diagnose ASD and how to understand other things that might present as ASD but actually aren't. And really understand, I felt like I left and continue to gain this knowledge with a really strong understanding of the nuances of ASD. If you can't tell, I really love this rotation.
Right. And for the kids that you test, they tend to sit as still as the people in the background of your coffee shop right now.
No, usually not. Usually we see them wiggling under tables, but that's okay because I have a strong background in PCIT too.
All right. Well, thank you for sharing about that, Abby. So again, this is on the medical campus. This is an assessment where it's 1 day a week. There's the team meetings on a separate afternoon, and it's a very cool team, and it's a very unique assessment experience that really, in the idea of promoting integrated behavioral health care, and in this instance on the assessment side of things, it really is a great model for doing assessment. But as Abby was saying, not every kind of assessment needs this interdisciplinary evaluation. So we will now shift to hang out with our friend Meg to talk about ASAC and kind of what that looks like within the clinic. Again, her clinic is down on the Gables campus. So Meg, take it away.
All right. So ASAC stands for the Autism Spectrum Assessment Clinic. So the main thing that we do there is assessment. It's an assessment heavy rotation. But yeah, we all love assessment. So that's why we're here. And hopefully that's why you will be too. In our clinic, we have three main referral sources. So we're seeing clients of very different kind of presentations often, but also different purposes for testing. So one of our main grant-funded project is to do assessments for children who are presenting to the public school system for the first time and in need of special education services. So we'll do the testing with a contract with the public school that will determine whether or not they meet educational eligibility. But because we are a team of psychologists, clinical psychologists, we can also provide that clinical diagnosis that will then also give them access to therapeutic services outside of the school system. So kids in that referral source are under 5. We get the referrals directly from the Miami-Dade County Public Schools or the Birth to 3 program, Early Steps. And so I'd say that's the bulk of what we are doing and seeing at ASAC. But we also have another referral stream, which is our private pay or self-pay clients. So those clients range in age. We see the itty bitties all the way up to adults, elderly. And then these cases are typically difficult to diagnose. So they're presenting with a complex presentation, may come in with multiple diagnoses that don't necessarily seem to, complete or tell the whole story. And so we will do a comprehensive psychological and or psychoeducational assessment. The last referral source is actually a recent project for us. We were able to secure funding that will allow us to provide those types of very comprehensive assessments for free for individuals who are coming from historically underserved or underrepresented communities. So these assessments can be very difficult to find and to access and to pay for. And so this will fully address those differences in equity in this area. So it's been very exciting, very successful. Our approach to assessment at ASAC 2 is yes, comprehensive, as I mentioned. We also take a culturally responsive and neurodiverse affirming perspective. So a lot of the language that we use in our reports is coming from kind of that perspective. And we use a culturally informed intake procedure that specifically asks and addresses questions related to diversity and cultural background and identity. So that's definitely something that trainees will walk away from, and being able to approach and understand a case from that perspective, as well as a very thorough understanding of autism and the way it presents, and how that can be very different. No case is the same ever. So that's also very exciting, and trainees will really leave with a very deep understanding of that, and being able to make that differential diagnosis.
And I know that we get this question every year, and I know it changes from year to year. So just kind of more generally speaking, and I know it's not a formal part of the specialty track, right? Assessment is the part that is the specialty track. But there have been individuals in the past that stay on because they also want to get some intervention experience. Can you talk a little bit about intervention experience and kind of like what's going on down at ASAC there?
Yes. Yes, so you can choose to do an elective rotation where you could participate in any one of our intervention programs. So we offer a behavioral parent training program. So it's based on the Ruby model. And we have a BCBA on staff that helps run that program and provides supervision. She also is running an NDBI, so naturalistic developmental behavioral intervention. So parent coaching model focused on enhancing social communication skills in very young children with ASD. So that's another piece that we're doing. And then we have a social skills intervention for school-age children.
So just a couple things going on,
Just a few things. I didn't mention also that while we don't have as many disciplines as IDES, we do offer multidisciplinary assessments for the children who are entering the public school system. So we do have a speech language pathologist on staff who is part of those assessments, and we collaborate very closely with her on those.
And I'll also say, because wherever Meg is having coffee today, it looks like a lot of fun, is that the ASAC crew also has a lot of fun. And it seems like everyone that goes there, like they just want to stay there. And I can say that we've tried to poach people from there and they don't want to leave there, right? Abby's like one of the few that we actually got to, but she still collaborates with people at ASAC. So it's a really cool and fun environment, and the people that work there really do enjoy the work that they do, but also the individuals that they get to work with there. So, all right. Any other very important like take-home points of like, hey, applicants, you need to know this about our rotations, and if not, that's fine. I know it's a lot of pressure. And you also get a chance to talk with them during interviews and meet and greets. But anything else you can think of?
It is, yes, as Jason said, a very fun environment. I would say both arms of the rotation, both at IDES and ASAC, but it's also very fast-paced and intensive. I mean, writing reports and doing assessment is involved. And so you need to be, willing and able to do that work, and, very detail oriented, organized. But above all, love this work and love the kids that we get to work with, and just, be part of the team.
I love that transparency, because this position historically works more hours than the other positions, because you have two, assessment rotations where you're working on things at the same time. So it's my job to always try and make sure we're balancing the rest of your schedule. But yes, I think that's a very fair statement for you to have. So thank you both for your time. Again, Abby, very impressive with the people in the background, just continuing to stay still. You should go up and ask them if they want to receive psychoeducational training. And then Meg, thank you as well. And we look forward to you getting a chat with all the applicants here pretty soon.
In the next overview, you will learn about our funded clinical psychology track. You will also learn about some of our clinical psychology elective training tracks, including psychological assessment service and child protection team.
Hi, everybody. We are here with the clinical psychology supervisors, and this position for applicants is made up of a couple different rotations. So it's made up of the pediatric psychology clinic, which is the clinical child focus, where Allison Weinstein is the supervisor for that. It is also made up of a PCIT rotation. Allison is one of the supervisors for that, but we're not going to talk about PCIT during this particular Coffeehouse chat, because you'll be able to hear that in kind of our parenting overview. We have Paula Perez, who is one of our supervisors for IDES, which was talked about in a different video, but she'll talk briefly about kind of how things might be a little bit different working with her on that, as well as her experiences in psychological assessment service. NIE is one of our other supervisors for psychological assessment service. You may also see her pop in to something with Parent Club as well. Allison is also one of the Parent Club supervisors. We all wear lots of different hats. This is just one of my many hats that I wear, and we have my old intern supervisors from a few moons ago, not that many, Dr. Susan Dandies, who's the clinical director at Child Protection Team. Now, her specific rotation is an elective rotation that some of our applicants choose to rotate through. It's a really cool experience. It's very unique. It's one of the few places in the country where you get that opportunity to do that. So that's kind of who is here with us today. I always like to start with a hard-hitting question. When we're having this chat, it's kind of the middle of the day. Maybe people are starting to drag a bit. So what is your go-to hot beverage or coffee? We'll start with you, Allison.
Oh, I love that question. Okay, so I do love coffee and I like a good latte, but on any day I prefer a hot cup of tea.
Very nice. My wife had a dream about me making her cafe con leche this morning, and I'm like, I've never made that before, but I figured it out, and it turned out not terrible. Not great, but not terrible. So, all right, Paula.
So I'm definitely with your wife on a cafe con leche, but I also like a white chocolate mocha with some cinnamon on it.
Interesting with the cinnamon. I have not had that. Now, is that seasonal for you, the cinnamon, or like year-round cinnamon's good to go?
Year round.
Okay.
Cinnamon lover. Mm-hmm.
Very good. NIE, what's your go-to?
My go-to is cortadita, which is a small espresso with frothed milk, and I also like cappuccino with cinnamon.
All right, we got a couple cinnamon fans here. Dr. Dandies, what you going with? What's your drink?
I'm easy. I am a black coffee girl. Hot in the morning, iced coffee in the afternoon. No sugar, no cream, just black.
Okay, but like dark roast, blonde roast, like where are
Dark
you?
roast, like fuel, like gasoline, dark roast, black, nothing in it.
All right, I'm gonna hook you up with some of the coffee I get that is the most caffeinated coffee that has like a skull on the picture of the coffee brand.
Bring it.
It's an interesting taste and flavor.
I look forward.
Great. All right. Well, I know what is getting sent your way. All right. So we'll talk a little bit about the rotations, just giving the applicant some sense of what they might expect. Obviously, like all of our meetings take place in coffee houses, and the vibe is totally just as cool here in person as we have here virtually. But I'll start with more of the therapy side before we get to the assessment rotations. Allison, could you tell us a little bit about kind of your outpatient therapy rotation? Again, the PCIT rotation we'll talk about in a separate video that is related to parenting.
Yeah, so the PPC clinic is an outpatient therapy clinic, and we run on Tuesdays from 1 to 6:30, providing therapy and intervention services, as well as some behavioral evaluation services for children and adolescents. We focus on evidence-based treatments, treating behavior problems, treating any kind of social concerns, social skills, treating emotional needs as well, anxiety, mood disorders, also trauma and parenting concerns as well.
What you might see in a lot of the other things that we have that are related to therapy, they're a little bit more narrow band in scope in terms of the focus, but within PPC, it's a little bit more broadband where you can get broader exposure to a wider array of presenting problems. All right. Paula, give us a quick, what is Paula's version of IDES? And then we could talk a little bit about your flavor of psych assessment service, and then we'll get to NIE's flavor. Hopefully they're not too much the same in terms of cinnamon that you bring to the rotation.
Sure. So I'm, like Jason had explained, I'm one of the IDES supervisors. The experience of trainees in supervision with me and rotation with me through the IDES clinic is very similar to Dr. Dollins, and I'm sure you probably had an opportunity to hear from her. I think one of the differences would be that trainees would be exposed to bilingual testing in Spanish, and also the opportunity to assess patients that may present with a wide range of medically complex cases because of my neuropsych background. So we might be also getting referrals, a little bit more, some referrals for neuropsychological assessment of both younger kids and older kids. So that's kind of like one of the difference in terms of the IDES rotation.
What about PA?
Now, the difference between PAS and IDES, because both are assessment rotations, it's that IDES, it's more of an interdisciplinary clinic, meaning that trainees in this rotation would have the opportunity to collaborate with clinicians from other disciplines. And a of the results of these evaluations are then integrated, and as a team, a diagnosis and recommendations is formulated. Whereas in PAS, you'll be rotating primarily with a clinical psychologist or neuropsychologist, and the evaluation is geared more towards, comprehensive evaluation that might include also some aspects of what a speech and language pathologist might evaluate, which is expressive and receptive language, what OT might evaluate, which would be more fine motor and visual spatial organization and integration. So we bring all of those different pieces into our comprehensive evaluation, but we're not necessarily collaborating with clinicians from other disciplines. We also, through that rotation, would be exposed to a wide range of clinical presentations, from neurodevelopmental disorders, including attention deficit hyperactivity disorder, learning disabilities, intellectual disability, and so forth. But as well as very, sometimes complex medical cases, including traumatic brain injury, neurological disorders, epilepsy, as well as congenital heart disease. So trainees that will rotate in this rotation will be exposed to just a wide range of clinical presentations.
Very cool. And NIE, your version of PAS for applicants that get to hang out with you.
Sure. So I am one of the supervisors for PAS, and I have a lot of things in common with Paula, actually, besides Cinnamon. We've both bilingual evaluations, and we've been doing this for a very long time, and we have a wide range of Spanish assessments. And we do definitely when the child speaks Spanish, or where we have a presentation where both parent and child speak Spanish, so we need to interact kind of with both. And we also, at times, our reports are written in English, but we may need to write a summary for the parent in Spanish. So it doesn't have to be, you have to be fully Spanish speaking, but definitely you can benefit, and maybe I could do part of the bilingual testing, the Spanish testing, and then we'll do some other part in English for sure with the kid, because they go to school in English. And so, like Paula was saying, PAS we see a variety of cases, psychoeducational evaluations, neurodevelopmental evaluations, and we'll do some neuropsych evaluations for sure. I particularly like to work with a lot of kids that have been pediatric cancer survivors that get referred to us. We used to have our own clinic with that, but now it's merged with PAS. Plus, kids with other medical conditions, suspicion of autism, but also plain ADHD, learning disabilities, complex emotional, cases with some learning problems. So definitely is a wide variety of cases.
I think,
pretty much. I'm repeating what Paula said.
I mean, there's little twists, right? So we have multiple assessment supervisors. There's going to be some nuances. There's going to be some nuances in terms of how they approach training. And that's one of those things that we just try and figure out based on people's prior assessment experience when they come hang out here, or goodness of fit in terms of what they prefer in terms of, training style, or kind of their prior exposure to assessment batteries that might be closer to particular supervisors. Obviously, scheduling sometimes comes into play there. I think one thing that's a real strength of our program is that we have numerous bilingual supervisors. I am not one of those, but I'm impressed that we have so many. And I think sometimes applicants are like, well, but I don't speak Spanish, or I don't speak Creole. Like, how am I going to survive in Miami? And I will say that there's just more than enough cases to go around for everybody. So that's something that you have a concern with. That's not something you need to worry about. It's something that, again, there will always be more than enough cases. But if it's something where you are particularly interested in getting bilingual training and assessment, that is a unique strength that we have in this program. All right. So those are core parts of that position. Again, PCIT also fits into that mold. But one of our unique elective clinical psych rotations, also more on the assessment side, it's not an intervention side, which Susie will tell you, is child protection team. But tell us about child protection team, Susie.
Child protection team. Child protection team is our forensic assessment team. We are a multidisciplinary team. We are charged with the assessment of allegations of child abuse and neglect. So that will include physical abuse, sexual abuse, regular neglect, and medical neglect. And as I said, we're an interdisciplinary team. So trainees that come and spend some time with us will be trained, obviously, to work with the pediatricians, the nurse practitioners, the social workers in formulating our opinions, to help direct the court system, the legal system, law enforcement, and social services in guiding the best interests of the children. So it's important to realize that many of our cases are accidents, are not child abuse. And so it's equally important for trainees to learn how to evaluate a case that is not abuse, as opposed to thinking that all cases are going to be positive for abuse.
Right. Even if there's allegations, it does not mean that it's abuse, but doesn't mean that there aren't other things that you can make recommendations about that might be helpful for the family, that might prevent future maltreatment of some sort from happening.
Correct. And we work very closely with programs like PCIT, even Psych Assessment Service, in referring many of our cases for additional necessary services once we do identify other problems.
Yeah, and I would add is that this is a rotation. I think sometimes people get a little bit anxious or worried about kind of the stakes of these evaluations, and this very much is a hands-on training experience. Dr. Dandies is always working directly side by side.
Literally hands-on.
Hands-on, yes. So if that's something you're concerned about, that is something that you do not need to worry about. Dr. Danny has been doing this for a long time, a seasoned pro, and lots of people get just an interesting, training experience with it. So some of this may be similar, but we always, if people are going to come hang out for us for a year, or sometimes they hang out longer, we want them to get some sense of kind of what skills that they feel like they could walk away with. So it could be new skills that they're walking away, or enhancing upon existing skills that they already have. So I'll start with Allison with kind of the therapy piece, and then I'll just kind of let it be a free for all for our assessment folks, and just kind of see, what skills that they think. And again, I think CPT might be a bit more unique from PAS and IDES on that front in terms of the skill set.
Yeah, so I think one of the main skills that you would get working in PPC rotation would be really honing your skills in evidence-based interventions. So because we get such a diverse set of patients through our clinic, that you really get to try a lot of things, practice a lot of things, and importantly, get a lot of input, not only from me, but from your peers who may also have a lot of experience with different EBTs. I think you also get some experience doing case conceptualization, because we focus very heavily on conceptualizing cases in order to provide the best treatment that we can. You get interview and assessment skills that are geared toward providing the best possible treatment. And another nice piece of PPC, I think, is really the collaboration piece. And so not only collaborating with maybe psychiatrists or pediatricians, other professionals, but collaborating with your peers in a group supervision format really brings a lot of value and a lot of practice and skill for trainees coming through to not only collaborate on their cases with their peers, but to provide collaboration to their peers.
Very cool. I'll go to the PAS folks next, whoever wants to go first, or you can just, jump back and forth just very quickly. Rapid fire, one word only, the skill that they're going to get.
Okay. So I think for both ICE and PAS, I think trainees that rotate through these two clinics are going to be able to enhance their assessment skills by being exposed to a wide range of clinical presentations, but also to a wide range of measures that are going to help us assess different areas of cognition, of functioning, so including cognition, social functioning, behavioral functioning, as well as executive function and language and so forth. I think that's kind of like the, just the highlight of the rotation. But I think After that, I think it becomes also the ability to integrate findings, to interpret results, and also to formulate diagnosis based on that integration of results. That's going to yield us to be able to make appropriate recommendations for the patient and also for the family. I think one important component will be also to hone on skills if they haven't already been exposed to, or for those that already have experience with, with working with different type of cultural backgrounds. It's going to be to learn or be exposed to consider cultural factors in test selection and how those play into the interpretation of those results, and being exposed to what are some of the areas of concern that we have in terms of the norms that are available for clinicians to use in the United States when it comes to evaluating individuals or folks from other countries. Geographically, I think that's one important area to highlight, that we are exposed to just a wide range of clinical presentations, but also to cultural backgrounds because of our geographic location. Of course, also test selection in terms of having a wide variety of Spanish measures that are available, and having supervisors that have been trained extensively on interpretation of these measures. And I think specifically with ICE, also the collaboration piece is important to highlight, because we do work as an interdisciplinary team. And then it's not only speech and language pathology and OT and PT, but also the medical team. So we're all part of the same team. And I think being exposed to these other disciplines is really enhancing in terms and edifying in terms of developing clinical skills over time.
All right, NIE, your version of PAS in 5 points or less.
That was wonderful. I cannot add anything else except for one of the areas I think that is important is a lot of interns come with a specific expertise. Like I said, they may not know, maybe more psychoeducational, not neuropsych or neurodevelopmental, and we add exposure and actually learning those testings, those measures with us, like hands-on, like Susan said, we're hands-on, like we're there with them throughout the whole evaluation, watching them, live supervision, live interpretation, we'll do it all together until they start, gaining those skills. So I think that's a plus, because I've had a lot of students tell me, oh, well, I was sent off to do this testing and nobody watched me. It's like, I'm like, what? It's like, I'm surprised. And we definitely bring that as needed. So that integration of this test and also the recommendations, I think that's a big piece. A lot of our students come like we just give general recommendations, and we're like, no, they have to fit, your diagnosis, what's happening with the family. They have to be evidence-based and also community-based, right? Because we have to know where to refer patients for different services in the community, in this community. So if you're not from this community, well, you'll learn those resources from us as well. So I think that's a big piece that we bring that usually interns need, and we guide them, hands-on.
Oh, for sure. All right, CPT, I feel like it's the movie Taken, where you get a very special set of skills from it. But what is the special set of skills that they're going to walk away with?
Yeah, they're special. Okay. So what will you learn at CPT? You will learn how to interview a little bit differently than most trainees are used to. So obviously we train forensic interviewing. So it's a different take on speaking to a child than the traditional clinical interview. You'll also learn how to write your reports for a different audience. You're not writing for the parent of the child or the physician that is treating the child. So our reports are written for the court, for a social service agency, and they have a little bit different flavor to them. And we say things in a little more cautious and factual manner than you would in a traditional evaluation. You'll also learn some interdisciplinary relationships that you wouldn't get in other rotations. Law enforcement is often on the premises. You'll work with detectives, with attorneys, both who are working for and on behalf of the child and perhaps not on behalf of the child, and how to navigate those relationships. And I think finally, one of the most popular things for trainees is actually participating in the medical evaluations of our physically and sexually abused children. After trainees do the interview, they actually go into the medical exam and participate in those exams with the physician or the nurse practitioner to document injuries, help comfort the child, be an advocate for the child since they've already developed that rapport. And those are a very different skill set than they're used to.
Yeah, I think that this rotation in particular is one that, whether you have a long-term interest in working with a child maltreatment population, or if it's just, something that you have an interest in and you just want to get a flavor of it, it does, I think, just overall just make you be a better clinical psychologist, because just even like learning how to ask questions in a way, and it will make you rethink how you do all of your other clinical interviews, because you're trying to make sure you're asking things that are not leading in any way, and that is a very cool skill that you'll most definitely walk away. So with that said, thank you all for coming from your respective coffee houses. I'm always impressed in these public settings how the coffee house Wi-Fi like holds up for the duration of the chat. So thank you for that.
And there's no customers.
There's no customers. So in Miami, that might be a problem. These coffee shops may not continue to exist by the time applicants get here. So but I hope you all have a great day, and I'm sure that the applicants are looking forward to getting to meet some of you when they get here virtually. So thank you all.
In the next overview, you will learn about our funded PCIT specialty track, but also elective parenting rotations, including Families First and Parent Club.
Howdy, everybody. We are hanging out with a lot of our parenting supervisors. If you did not figure out from our online materials, we like parenting, and we do a lot of it here at the Mailman Center. We'll be talking specifically about the primary rotation, PCIT, which again, if you are a clinical psych applicant, that is one small piece of it, but we also have a completely separate PCIT intern. Some of our PCIT supervisors here, we have Nellie Garcia, who is one of them, Eileen Davis, who is one of them, Allison Weinstein, who is also a clinical psych supervisor, is also a PCIT supervisor as well. So they'll spend a little bit of time talking about that today. We have Alana Mansour, who is part of our Families First program that leads that, and she'll talk about more group parenting initiatives for younger children. And then we have Anna Quadra and Allison Weinstein, where this is kind of our biggest reach, parenting workshops that they work on developing to kind of meet the unique needs of the community and just have broad reach, serving, always over 1,000. We don't know how many thousands, but always over 1,000. Families a year, which is really exciting and kind of a different way of doing things than perhaps people get an opportunity to do during their clinical training. So it's interesting to me. I don't know, Eileen or Allison, if you are in replica coffee shops in the same place, but it seems like you should be like sitting right next to each other. So if I hear, echo from back and forth because you're just sitting next to each other and I just don't know, that will be fine. So let's talk first about the things that clearly applicants want to know and they care the most about: your favorite hot beverage or coffee. So Nellie, what do you got? What are you going with? What is your go-to?
Jason, I made this one especially for this meeting. Latte.
Wonderful.
It's a lot less coffee, way more milk. But this is what you got me into, my Nespresso latte.
So Nespressos, and what specific Nespresso blend is it?
This is Diabolito. I think I'm pronouncing that okay. So it's like 11, it's intense.
I can't. I live off of coffee, and I can't do 11 into I top out at 7 or 8, and then I'm wired the rest of the day. So, all right, Eileen, what kind of coffee or hot beverage are you rocking with?
It really depends on what time of year it is. If it's then I want a Frappuccino. But if it's fall, anything with pumpkin in it, and anytime, whenever it's winter and the holidays, I want peppermint.
Peppermint. All right. And when do you kick peppermint out? Like, when is the expiration date on peppermint for you?
That's always tough because letting go of the holiday season is always tough. By the end of January, I got to kick it out.
Okay. Like, lights come down, but then peppermint has to go away at the same time. Okay. I hear you. All right. Alana, hot beverage or coffee?
So my choice is a cappuccino for a hot beverage, but
Okay.
I happen to love vanilla frappuccinos when that weather gets hot. So that would probably be my favorite.
Is it like a vanilla bean frappuccino, or is it okay? Yeah. All right.
Vanilla bean all the way.
That is one of my son's favorites as well. So NIE, you're muted.
Yes, I'm not muted anymore.
I know there's a lot of noise in the background at your coffee shop. You're trying to keep that noise down. I understand. I appreciate you having great like telepresence for this coffee chat.
Yes. So when I'm doing assessment, because I'm a psychological assessment supervisor, I like coffee to keep me awake. And then when I'm in parent club, it's just much more relaxed, easygoing. I do Thai.
What was it? I didn't hear.
Thai. Spice.
Okay.
Yeah.
Very cool. Very cool. All right. And Allison, for you, you might have particular beverage for when you're in your PPC clinic. Is it the same for you at other times, or do you also swap it up for parent club or PCIT?
Yeah, I'm gonna follow on with NIE and go on the tea train here because I love a good cup of tea, a little cream and sugar. I don't change it up for parent club, but I might go iced because that's, a little hotter in the afternoon.
Getting dangerous.
It's a little dangerous.
That's right. Because summer in Miami, if you're not doing it by 11 a.m. outside, you are not doing it. So, all right. So let's get into this. Let's find out kind of what your rotations are all about. We're going to start with our PCIT rotation. We'll go to Nellie first, kind of explain kind of what it is, or Eileen first, whoever wants to go. You guys can flip a coin, a virtual coin, and talk a little bit about what people would expect to do on the rotation. And then Allison, because she's like an OG of PCIT, maybe she'll drop in some additional nuggets. We don't know. We'll have to wait and find out. So.
For sure. I mean, there's so much happening in PCIT land, so I'm sure I'm going to need Eileen and Allison to add in. But really what you can get out of the PCIT rotation is joining a really friendly, warm, tight-knit group that really does an amazing job at trying to serve the needs of families within Miami-Dade County that have children between the ages of 2 to 12 that are experiencing elevated externalizing and now internalizing behavior problems. We have a few different projects that folks can be a part of. Each are pretty different but complementary experiences. We have our Natural Helper project that's been along for a long time and that Eileen and Allison can probably speak to even more. But really that's partnering with trusted community sites where we provide PCIT services along with weekly Natural Helper support. There's also lots of cool research happening there that folks can be a part of. We have our CALM program now, which is a new but super exciting, where folks can be a part of getting trained and then seeing cases where their primary concerns are their kiddos' anxiety. And then we have our typical PCIT services where we provide a time-limited format of PCIT, and that's in person, online, or hybrid. And a lot of cool research happening there that folks can join in on. And one thing that I do want to point out is just the Spanish support that we have in PCIT that I want Eileen to talk about a little bit more, because she runs our consultation group, which folks really enjoy, and is also one of our bilingual supervisors for PCIT.
Yeah, so that was a nice summary, Nellie. I think just highlighting the fact that we have a lot of supervision supports for our bilingual and Spanish speaking clinicians. And I think one of the really great things about our program is that you do come out of here with the technical skills. You do all of the skills for delivering the manualized protocol of PCIT, but it's so much more than that. It really is about having the competency to be flexible in delivering PCIT to meet the needs of very diverse families who are coming to us from very different places, very different points in their readiness and in their needs to be able to serve their children. So we really do kind of always are striving to be able to train our trainees to go out into the world and deliver PCIT, not just as a clinician, but really as a competent clinician to meet the needs of whatever community they're serving, and really knowing how the diverse needs of those communities. And one of the things that we do in order to be able to really support our bilingual clinicians in delivering PCIT in Spanish is meeting regularly to discuss kind of some of the nuances of working with our very diverse Spanish-speaking families, and also just things like coding and how are we doing our assessments, making sure that the assessments are appropriate for our families, and just going through some of the fun coding questions of coding in Spanish. So we really do provide a lot of support for our trainees with the goal of preparing them to really be able to serve diverse families wherever they go.
Any additional nuggets from the OG of PCIT down here?
Yeah, I would add that you really do get the benefit of a tremendous amount of experience, I think, that supervisors like Nellie and Eileen bring to this. And it really is a very rich experience, I think, to work with, Nellie and Eileen and other supervisors and other trainees. And really I would say that the group really cares about your training, and you're going to get a really well-crafted experience that's taken many years to develop. Yeah.
All right, thank you for sharing about PCIT. I like to call it our loaded potato rotation for parenting. So there's a lot going on, a lot of different things. It could, be vegetarian, or it can have bacon, whatever, you do you. All right, Alana, tell us about Families First, because that is a really cool kind of community opportunity. You get to hang out with parents of younger kiddos, and some cool stuff going on there.
Well, similar to PCIT, Families First is really a family. The majority of our staff have been around since we were initially funded in 2004. And so that's super nice. Everyone works really collaboratively. We have a lot of experience providing community-based parenting groups. And so there's a lot of support as well for any of the trainees. So Families First provides 2 evidence-based parenting groups in the community. One is called Baby and Me, and parents come with their infants to the group. And it's really a nice opportunity to get down on a mat, sit with your infant, learn about development and ways to foster the attachment relationship. Parents get Baby and Me items that they get to practice, to take home to practice skills that they learn in the group. They make scrapbooks. So it's such a nice opportunity to feel connected to other parents and to learn ways to promote development. Our second curriculum is called The Incredible Years, and this is for parents of children 1 to 3. This group meets once a week for 2 hours for 12 weeks. Baby and Me meets for 10 weeks. And for this group, just the parents come, but they learn a number of different ways to manage behavior, promote language development, and foster the parent-child relationship. They also get items related to the topics that we talk about so that they can take them home and practice the skills. And so it's really a nice opportunity for families to connect and develop relationships, since they're all meeting together for almost 3 months.
So, the cool part about what they do, what PCIT does, what Parent Club does, is that, because of generous funding from the Children's Trust, which is the local children's service council down here, we're able to provide services to families for free. So office-based, virtual, hybrid, community-based, just kind of a number of different ways of trying to reach and meet the unique needs of our very diverse community. All right, so let's hit up Parent Club, because Parent Club is a little bit different. It's a little bit different from people's kind of traditional clinic training model, but it has a pretty vast reach in the community. So I will let Allison or NIE, you could do rock, paper, scissors for who wants to go first, however you want to roll with this. So.
Allison, go first.
Okay, I'll start us off, Anaïs. So I'm excited to talk about Parent Club because it fits in this group nicely because it really grew out of our PCIT program and the wonderful support that we get from the Children's Trust in creating a single session, really, intervention in the form of a workshop based on PCIT principles that we are able to provide in the broader community as a universal workshop. So it's for, skills in general parenting that are great to share with the whole community. And when I say whole community, I mean the whole community, because we offer it not only in English, but also in Spanish and Haitian Creole to really meet the needs of the community that is here in Miami-Dade County. And that in a nutshell. So the workshops provide parenting skills, to that community for free. We are online, we are in person, we are everywhere.
We are everywhere. No, literally, if you look at like
3,000 a year.
I refer people, and they have a partnership where there's some other people that also do it, and you just look at any given week, and there's probably in any given week 20 to 30 workshops that families can attend at different times of day. Some are on the weekend, some are in the evenings, just really trying to make these things as accessible for families as possible. And anything you want to jump in and add on that front?
Besides the general parenting skills that come out of PCIT, like Allison said, we have a variety of workshops. I mean, from early reading literacy for kids 0 to 5 to adolescent tips. We just created a new adolescent workshop. We also have things related to using technology and partnership with other agencies that we're working with. We're always developing new workshops. And definitely in the future, we're also developing a toddler workshop. So we are reaching out to all these families, different ages, like I said, different cultures, and definitely different languages. And so it's great. We reach over 3,000 parents a year, only our agency. So it's very big.
Shout out to you. And there's going to be some commonalities in this next question in terms of the skills, right? So all of the people that do these rotations, they are going to learn a skill as it relates to improving their ability to better at teaching parents how to parent based on child's age, presenting problems, things of that sort in different modalities. I think, sometimes I've heard, and listen, parenting as an intervention is not for everybody, and that's okay, right? Like we have lots of variety here. But one of the things that I think about is I want applicants to really know, like, what are the unique things? So like, hey, I've done parenting. I don't need to do any more parenting. I'm all set. I'm all ready to go. What are the unique things that you think that they'll actually be able to walk away in terms of a skill set? So whether it's building on some existing skills as it relates to parenting, or it's brand new things, what are the things that you think they'll be able to walk away from their experiences on your rotation? So I'll start with Nellie and Eileen first, but really just anyone can jump in and add, because I'm sure there's going to be some commonalities between the different rotations.
I can speak to specifically with PCIT. One of the things that I think is really a great experience is working with trainees on how to become an effective coach, and the role of a coach that's so unique relative to just, when you're doing more traditional parent training, where it's just kind of talking to parents and then having them go home and apply the skills. With the coaching model, you're really in the trenches with the family, and you're getting to see things from such a different perspective. And now that we offer services virtually also, there's even another layer to that, where we're actually in the family's homes with them and really walking them through experiencing with them some of the challenges of all of these things that we're kind of recommending that they do. We're in the homes with them and actually there to support them as they're trying to implement them in within the reality of their home. And so I think that the perspective that you get as a clinician when you're doing that, when you're coaching a family, whether it's in the clinic or in the home, it's just such a different perspective. And I think it just makes you a stronger clinician overall, because it's not just about these things work, let me tell you what to do and go and do them, but I'm here to support you and be with you and really problem solve in the moment when you're actually trying to to implement this. So I think for our trainees, that aspect of it really strengthens their clinical skills, their problem solving skills, and just their capacity for empathy with families when they're actually there in the moment having to resolve the challenges with them.
Like, oh, this is a little bit different from a stripped down office when we're trying to actually implement this in real life. All right. Anyone else want to add on things as it relates to kind of things that people walk away with PCIT? I'd say like just the coaching and just in general, whether it's for disruptive behaviors or coaching children who are anxious as it relates to, like helping the parents coach them through exposures is kind of a unique skill that people may not get in other places. But Nellie or Allison or anyone else?
Yeah, I think, I mean, and Eileen touched on this a little bit, just the constant effort to align our support to the family's needs and approaching our services flexibly. I think that that's something that I really want to highlight, especially given the populations we serve, culturally, ethnically, racially, linguistically diverse populations that we serve, regardless of your PCIT background, if you're coming in already as a therapist or a trainer. I think there's always so much room to grow and continue to get that specialized training and identify what are the populations that you'd want to get more experience with and really think about how to best serve them. I think this rotation really lends itself well to those conversations. Allison,
Right.
I don't know if you have anything else there you want to add.
Yeah, just thinking about the confidence I think that you can build over the year in not only in delivering great evidence-based intervention in a flexible way, but also just approaching more difficult situations, which I think we're helping families in their most difficult moments with child behavior. And I think you really do develop a lot of confidence in your ability as a clinician to help families manage that with what we know how to do. And I think that's awesome.
All right. So families first, also unique experience, unique skill set that I think people will walk away with. But I'll let you sell it, Alana.
Well, I think Families First is a bit unique from our other parenting programs because we are providing services in a group. And so you learn a lot about managing group dynamics. If a parent mentions something that maybe isn't the most appropriate strategy for managing behavior, you learn kind of how to balance that without offending the participant who said it. So you want to be supportive to them, but you also don't want the group to think that this is the best strategy to use. And so I think that's a really big skill set that you get, is learning how to manage difficult group dynamics. You learn about child development, you learn about behavior management. And I think the other big piece is the community piece. We are working with collaborators out in the community, and we have to be available when they want us to be available. We really try to meet the families and our partners' needs as best as we can. And so I think being flexible and being able to meet the needs of our collaborators is a huge piece. So you really learn how to collaborate with different providers and different sites out in the community.
Parent Club, what you got? One shot wonders. Let's go.
Yeah, so what you walk away from, I think there's so much because the experience has so many pieces to it. So I think one of the number one things is if you do workshops, you're going to walk away with some incredible workshop facilitation skills, because we really, we work very hard on that. And we take the time to really give the feedback. That's something you want to do. We have numerous fidelity checks. You not only learn the content, but you're learning how to deliver a workshop in a really effective way. You're learning about working with funders in the community, which is an invaluable experience, whatever you may go on to do later. You're also working within our group and helping us with training projects that we do, also with writing content, because as Anais said, we're constantly developing new workshops. And one of the best things that you do walk away with is also learning how to collaborate well with other agencies, not only with the school system, which we work with, but many agencies in the community, and also our partner agencies, including another university and community agency as well. So I think it's a very, very rich experience and can really be crafted to what you want to walk away with.
Very cool.
Just to add to that, I think we also, a big piece of our program is linking parent with resources in the community, because it's not only providing the information, but through a survey that they get, evaluating the workshops, they can request additional help, or also in person, they can request additional help. And so we link them with PCAT, with Families First. So we're like a gate, to all these families that don't know about any of the other children's trust programs for therapy and parenting or whatever. We link them up and make sure that they at least get contact, hands warm off kind of approach, like they get contacted with someone, just not a number or something like that. So I think there's a big piece of what we do. And so you really quickly learn, what is available and how to do that to make sure the families get their needs met.
As you can tell, everyone here really likes parenting. You can see that parenting is not just one thing, but it is many different things. So thank you all for sharing your wisdom. And Eileen, Allison, great job. Even though you're sitting right next to each other at the coffee house, I've never heard any echo from either one of you. So well played. I appreciate it. And I'm sure that the applicants who get to meet with you will have plenty more questions, perhaps about your coffee or tea choices, or maybe things related to Mailman. Only you will find out at that point in time. So thank you all, and we'll talk later.
In the next overview, you will learn about our funded integrated pediatric hearing loss specialty track.
All right, and we are here with Yvette Sejas, who is the main supervisor for our pediatric hearing loss internship position. We're excited to have you hang out from a very fancy Starbucks today. So thanks for being here. Very important question I always like to start out all of these chats with is what is your favorite hot beverage or coffee drink for you?
Okay, so I am definitely a seasonal girl. So it really depends on what season we are. So I do love my Starbucks. So if it's November, we got my pumpkin spice latte. And in December, then we go ahead and do a caramel brulee latte or a chestnut praline. But one thing you'll learn if you end up rotating with us is that our 3 o'clock hour is always Cuban cafecito. So definitely that is also one of my favorites.
And if you don't know what that is, you need to know what that is and experience it, and also just prepare not to sleep that evening, potentially, if you're new to it. So you're one of the fanciest coffee houses that we will see during this overview, but you also work in probably the fanciest building the interns hang out with. So I mean, I like that you're really trying to demonstrate that from the coffee house that you're coming from. But I wanted you to be able to tell me a little bit about kind of what interns or other applicants might really expect to get out of your rotation. I know that it's really well integrated. It has very much a pediatric psychology focus to it, just kind of a different application of that. But perhaps people just don't know as much about this, and you can fill them in on that.
Absolutely. And so everything you said is 100% correct. Most people hear the word hearing loss and they immediately get frightened and kind of turn away. My background and training, as well as most of the interns that do really well here, have a strong foundation in pediatric psychology. So before I grew to love and built the passion for pediatric hearing loss, I really worked with oncology, diabetes, every other rotation you've probably already heard about. But our rotation actually gives you the opportunity to learn about more rare conditions. Do we see patients who also, have hearing loss due to chemo treatment? Yes. Do we have kids with genetic conditions or neurodevelopmental disorders? Yes. So really, if you have a background in pediatric psych, whether you really enjoy consultation liaison, or whether you're more just interested in neurodevelopmental assessments, we can absolutely make that happen in this rotation. You will have the opportunity to do evaluations that are either referred from the school or internally from our hearing implant program, or whether we get a rare referral from a lawyer because a child with hearing loss isn't getting adequate services in school. So I really like to tailor our rotation to individual trainees' needs. And I guarantee that you will absolutely get great assessment experience. You also will be able to do consultation liaison, and then you'll also be able to follow, a group of families and do more of your traditional outpatient therapy.
Yeah, your rotation actually checks a lot of the boxes in terms of our program-wide competencies more than any of our other rotations. So that's another unique benefit, especially for interns, because they get the opportunity to actually have more variety in the other elective rotations that they pick from, because they're checking so many boxes when they come and hang out with you. So your rotation, and not that I would ever view you as a competitive person at all, but you have an extremely good record with your alumni from your rotation going on to get faculty gigs or just get really high caliber postdocs. So clearly they walked away with something from your rotation and the training that they got there. But for the people that you'll be meeting with or will want to meet with you, what might you expect for them to get out? What would be like the skills that are now enhanced or stronger because they came and they hung out in Miami with you on your rotation?
Yeah, so I think one of the skills that you absolutely either you will come in with or you definitely will build upon it while you're in our rotation is learning how to think on your feet. And learning how to be assertive with a range of different providers. So we are a multidisciplinary team. And when I say multidisciplinary, I mean you have physicians, surgeons, you have audiologists, you have speech and language therapists, educators, psychology, social work. And so we all are on the same floor. So you have to learn how to interrupt people. You have to learn how to not be aware of anything regarding a case and be able to walk in and be able to kind of freely be able to kind of communicate with a new family or a new provider that maybe you haven't met before, because we are such a large team at this point of, over 30 different providers that you'd have the opportunity to work with. So I think it's building on that self-confidence as well. And then you'll also, which I think is unique, is one of my biggest passions also is just clinical research. And so you will not be able to escape your rotation, whatever you select, without learning how you can not only be a clinician, but also be in academia and learn how to integrate that into your various roles, potentially in an academic institution.
So it sounds like you get quite a bit out of your rotation, lots of different things that you can do. So lots of variety, even though it's a particular population, and there's still lots of variety in terms of the service modalities, but also opportunities for research. So I'm always excited to kind of see what's going on over there. And again, if you can get over there for the cafecito, even if you don't end up on that, do you let people in like at 3 o'clock if they're from the outside, or are they banned?
Sure. We can make it happen. We all, if you don't know how to make cafecito, I promise you will learn. If you don't know, having sugar with your coffee, it's an absolute must if you're going to have our shot of Cuban coffee. But, one of the things is that even though we're very busy, we're also work together like a family. And so like you said, every trainee who's come through the door has really been successful. My intern from 2 years is actually going to be starting as faculty now. And so, we will work with whoever walks through that door. And even if you're a little bit, afraid, then this is your year. This is your training year to figure out what do you want to do when you enter a postdoc, or what do you want to do once you're licensed. So if you give us that opportunity and the shot, then I absolutely will not regret it. And you'll have really fantastic training throughout the year.
Those are great plan words. That was beautiful. So, all right, with that said, I will let you go. I'll let you get back to your very full coffee house because, normally Starbucks, there's nobody there, but enjoy that. Thank you for hanging out today and really appreciate your time.
All right, cheers.
In the early childhood overview, you will learn about our funded early discovery position and the elective rotation. Early steps.
All right, so I am here with some of our early childhood supervisors. So we have Ruby, who oversees our early child funded position, that specialty track within early discovery, and she'll be talking in a few minutes more about that. And then we also have Michelle, who oversees early steps, so she gets to hang out. Both of them get to hang out with babies and toddlers and all of that fun stuff. But their rotations are a little bit different. We'll get into that. But first, with the hard stuff, the difficult questions that everybody wants to know. I'm sure that the applicants are probably getting tired of me saying that. Favorite hot beverage or coffee drink or caffeinated beverage? Ruby, what you going with?
All right. So I am not a coffee drinker, but I do enjoy an espresso every now and then. And on weekends, I will treat myself to an espresso-tini. That is by far my favorite coffee drink.
There you go. It's got a little extra something special in it.
That's right.
Michelle, what are you rolling with?
All right, so I am also not much of a coffee drinker, but I do really like the colados. I can do about a little half of one of the little tiny shots, and they still make me a little jittery, but I like the taste of them, so I'm going to go with the colada.
So my question for both of you is, you're not big coffee drinkers, but you're hanging out at coffee shops. Like, that's really weird.
You know, we like to mix it up a little bit.
That's right.
I could still do something different of get like a chai tea or a hot chocolate or something else. So.
Right. And it just seems like it's nice and like there's peace and quiet there. There's nice ambiance where you're at. So maybe you'll be able to get some work done. So, all right. So let's get into this. First, talk to Ruby about early childhood, your specific specialty track, which is unique. And again, I think it's one of the few rotations kind of like it in the country, where people can get such unique experience working with the early childhood population on more of the intervention side of things.
Yeah, sure. So exactly like you said, I think it is quite a different rotation than some of the others because it takes place in mainly the community. And the purpose really is to provide intervention services for children birth through 5 who do not qualify for state funded programs, which intersect really nicely with what Michelle's going to be talking about in a minute. And so by intervention services, I mean behavior therapy as well as developmental services. And by community, I mean working in parents' homes, so in person in parents' homes, in childcare centers, or virtually. You can do a hybrid model, telehealth. Some of our therapists see kids, in the home, in the childcare center, and also virtually. So you could do a combination of all three. We also serve all of Miami-Dade County, which is really great because our community is very culturally diverse. And so you kind of get a breadth of experience working with, this diverse community.
Very cool. So, and again, when we say it's, our county is, it's pretty big, and it could be 3 miles away, and depending on the time of day, 3 miles may not take 3 minutes. It may take slightly longer than 3 minutes, but I know that Ruby's crew, to the best of their ability, really does try. I am the person with bad telepresence, with letting things ding during this. I am terrible. So one of the things that, that they try and do is that they really try and kind of coordinate people's schedules so that they're not going from like down in Homestead up to Aventura, because otherwise you're just living in a vehicle. So I know that that's something that they try and pay attention to.
For sure. We have 26 therapists. So everyone kind of has their own pocket of the county that they serve. So you will not be driving all over the place, I promise.
Very cool. It's recorded. If it ever happens,
you
play this back. You play it back and be like, you said this. All right, Michelle, tell us a little bit more about Early Steps.
Sure. So for the Early Steps program, we're seeing the kids with more significant developmental delays and disabilities. So kids who are birth up until their 3rd birthday. And so this is part of with Early Steps, part of the state federally funded IDA Part C. So for, people coming in from other states, they may not recognize that Early Steps name, but they may recognize instead that IDA Part C. And so whereas Ruby's clinic has got much more of that intervention focus for the Early Steps trainees are focused in on the assessment side of things, and specifically eligibility assessments for Early Steps. And so a little different from traditional psychology evaluations that really focus on determining a diagnosis. These evaluations are really about working with a multidisciplinary team, whether it's done in person or done virtually for those assessments, and working with the team to determine if a child is qualifying for early steps, what types of early intervention services that the child will need, and working with the team to make that determination and developing those intervention plans.
And you have the world record for having a assessment rotation where the actual reports are actually completed within the rotation time. None of our other assessment rotations can do that, but Michelle's does.
It is a self-contained, because everything is done as part of that clinic time. It includes the evaluation with the family, the report writing, and the feedback with the family, because it's really important for us, because for families to be able to start with those early intervention services, they've got to get that family support plan completed. So that's where it's a quick turnaround time, but it's a different type of report that is able to be done in that kind of timeline.
The reports are only 50 pages, so
it's a much shorter. But yeah, it's a lot of things where it's got kind of, these are the set things that matter. You learn to really write those focused kind of reports as to what are the questions we're trying to answer for this family, what's going to give the information out to the providers so that they know what to do next along the way, and really focused on really practical interventions and strategies.
So modalities, populations, slightly different between your two rotations. Obviously, if people are thinking about coming to hang out with us for at least a year, sometimes people hang out with us longer, once they become 305 till you die. And one of the things that I always like to ask the rotation supervisors is, so maybe somebody already has like infant mental health or early childhood experience. What are kind of some of those additional skills that you think they'd walk away with on your rotations? Or if they've done none of this, what are some things that you think if they rotate through you either as like a funded specialty track, or they hang out with you as an elective rotation, some of the skills they can walk away for that?
Yeah, so great question. So because we work with the little ones, babies, and by babies I mean 6 weeks to 5 years of age, not everyone comes in with a lot of experience with that age group. So we hope that the intern would gain, or applicant would gain, some breadth of experience with the babies all the way up to the older preschoolers. And also some people might come in with some experience related to behavior therapy, common, but not as much related to developmental therapy. So we try to strengthen those skills by giving the applicant some really concrete experience working using the Early Start Denver model, which is a great program, evidence-based, working with, especially with the little ones. And I think, some of the intangible skills that way important to me and that I really like seeing is just getting experience, like I said, working in the community. And kind of experiencing a naturalistic environment, what that's like, very different than some of the other rotations that are more clinic-based or hospital-based. And then lastly, enhancing your skills as relates to working with a diverse population, children with disabilities, even though they may be mild, and then kind of with shared life experiences as well. And so it's really well-rounded, I think, but I'm biased, so.
What? Bias about our own rotations? That does not sound like us. Michelle.
Sure. So I think there are a few things to kind of think about for trainees. One is there are sort of a few different options within early steps. One is the more general piece focused on children who are coming in, wide range of, developmental disabilities and delays, or there are individuals who choose to focus on the more kind of specific targeted or NICU follow-up piece. So that's one of the options if people want that more medically complex. There are two options with that. One is with our little bit older kids who are getting that NICU follow-up, and the other is our infant clinic that is specifically targeted towards those NICU referrals for kids who are coming in under a year. So sometimes people may have had some experience with toddlers, but really want to focus in on the babies, or want that more medically complex if that's an area of interest, or who want that more breadth of experience. So that's where there can be some differences on the, different early steps clinics that can meet in that way. Some of the big pieces is, as Ruby was saying, we really are working with, really diverse population of families coming in from lots of different backgrounds. Because these are really specialized clinics, they really do draw from throughout the community. And so it's something where we're working with a lot of different families who are coming in with a lot of different levels of kind of when they're coming in of, some families coming in where this is the first conversation that anyone's having with them about the concerns they have for their child, others who have, been to lots of specialists, and this is the next step along the road. So I think being able to talk with families where they're at that moment is a really good skill that people walk away from this rotation with, as well as that ability to work with providers across multiple different disciplines and to be able to think about what are the kind of, intervention supports that's fit for this specific family at this specific moment in time. So I think that's one of the other big pieces that comes into play that, individuals are able to get. And I, do really take a developmental approach with supervision of their individuals who come in and they're really ready to, get off the ground running really quickly, and others who they've never seen a kid younger than kindergarten age before. And there's going to be more, support along the way to get them up to that point.
Yeah, and I think those are all really great skills. I think, your two rotations really stand out on our early childhood front. But, for folks who may be kind of skipping around in the video, a lot of our other rotations, also elective rotations or specialty tracks, have an early childhood focus. So if you're somebody that has a particular interest in kind of the 0 to 5 age range, there is quite a wide array of experiences that are available here where you can really build that out and specialize that and set you up for whatever next thing that you want to do in kind of that 0 to 5 age range. Well, thank you both for hanging out with me today. And I know the applicants will be super excited to get to talk to you more about your rotations and the cool things that you are doing. So, all right, take care.
All right, thank you.
Hi.
Right, I'm here with Dr. Maite Shanker, and I'm going to be learning about, some might call it primary care. We kind of categorize this under our early childhood rotation. It's kind of both. So welcome to your coffee house. It looks very nice where you're hanging out. First question, what is your favorite kind of hot or warm beverage?
Okay, I would say probably a latte with almond milk and some kind of flavor. So love the pumpkin spice in the fall.
Nice.
Could be vanilla, could be anything like that.
And do you ever find with almond milk when you order it out that people scorch the almond milk, or do you find that it's okay for you?
It's really okay.
Okay, maybe I'm just the only one getting scorched almond milk. So I'm all team almond milk. Well, we're excited for the trainees to learn about healthy steps as a rotation. Just the question I've kind of been asking everyone, maybe a little bit more about what healthy steps is and kind of what residents would expect to get out of this elective rotation.
Sure. So Healthy Steps is a primary prevention program for families, specifically of children ages 0 to 3. The Healthy Steps specialist works alongside the pediatrician and other medical personnel. They meet with families during their well child visits. And we currently are working out of 3 different pediatric sites. We follow a 3-tier model where in the tier 1 we do screenings for development, for postpartum depression in mom's cases, and as well as social determinants of health. So those concerns, and we identify families that may need additional supports based on that. Tier 2 is very specific concerns that a family may have, and so we meet with them up to 4 times to address those concerns. And then tier 3 are families that are higher need, where we enroll them and follow them until the baby turns 3. The students that do a rotation with Healthy Steps would be pretty much doing all the functions that a Healthy Step specialist would do, working in one of the clinics, very much as a member of the team, integrated into the clinics. We ask that the students do at least 8 hours per week,
And we find that it is a better experience for the student to break it down into 2 days. We try to pick days where the clinics are the busiest and we have the most number of babies that usually come. So that setup has worked well up until now.
Yeah, I love that it's an interprofessional experience. I love the fact that there's already an established team there. So, for people who perhaps have not had primary care experiences, there's a dedicated staff member to kind of be able to show you the way. I love the tiered intervention approach. I think that is, we have lots of different rotations that are kind of at one of these 3 tiers. The cool part about Healthy Steps is that it exists at all of those different levels. So, the trainees really get a variety of experiences.
Yes, absolutely. And yeah, and we meet you where you are. If you come with more early childhood experience, then you can work more independently from the start. But if you don't have any, we can provide a lot of training, very much following that developmental model of training. You would work very closely with the other Healthy Step specialists in the clinic. So you're really never alone in the clinic in that sense.
Very cool. Well, thank you so much for sharing about Healthy Steps. You all will get to see more of Dr. Shanker at our virtual open houses. She is the Associate Director of Training. So she'll be hanging out with me, with you on your interview day. Take care.
Bye.